Blessings one and all. It is with great honor I stand here today among such a dedicated group of people. I want to express my gratitude to Grace Hill Bible University and the Victorious Living Foundation led by Dr. Nicole Francis Cotton. Dr. Francis Cotton is someone I deeply respect, not only for her hard work as a certified holistic health coach, but also for her unwavering commitment to improving lives. Guess what? VSR too is in the profession of improving lives. For this reason, we did not hesitate to collaborate with Victorious Living Foundation on this important initiative, in particular for this sensitive topic of suicide, that will be addressed from different perspectives. Suicide is a silent crisis that impacts individuals, families, entire communities. Suicide is on the rise in our community, with the most recent victim only 14 years old. As Minister of Public Health, Social Development and Labor, it is my responsibility to help break that stigma. We must understand what brings someone to such despair and work together to providing hope and support. By raising awareness and having open conversations, we can save lives. With regard to the participants in this masterclass, based on conversations and their professional backgrounds, I can state with confidence the knowledge and commitment in this room have the power to change lives and strengthen our community. Your efforts are building a future where no one has to face their struggles alone. Let us remember that suicide prevention is a shared responsibility. It is something we all can contribute to as family members, friends, and community members. Together, with God's guidance, we can create a network of love, support, and understanding. Thank you, and may God bless you all.
My name is George Richardson, and I am a student from the Grace Hill Bible University, St. Martin campus. My presentation is about igniting hope, preventing suicide. Suicide is the act of intentionally taking one's own life. It is a serious public health problem that can affect people of all ages and groups. Beyond causing harm to those who are died or are injured, it also impacts the health of their families, friends, and the community. CARE is a package for suicide prevention. The abbreviation from CARE is Community Awareness, Resources, and Education. Why do people choose suicide? Suicide is not about wanting to die, but rather about wanting to live. Suicide is about escaping unbearable pain. Suicide is a means to try and end a situation in which a person feels trapped. Suicide and public health. The need to improve training and skills in suicide risk assessment and management is imperative. Suicide is the second leading cause of death amongst Caribbean youth between the ages of 15 and 25. This was a study done by the Global Mental Health Action Network. Nearly 16 million adolescents ages 10 to 19 live with a mental disorder in Latin America and the Caribbean. A United Nations Children's Fund report pointed this out. On St. Martin and in the Leeward Islands, death by suicide has been minimal compared to the wider world. This was a study done by the World Health Organization. The World Health Organization has found that for every death due to war in the world, there are 3 deaths due to homicide and 5 due to suicide. The myths and stigmas of suicide have historically silenced us. Myths and stigma have convinced us that talking about suicide carries more risk than not talking about it. Without accurate information, we have been scared into silence. Myth versus fact. It is too risky to talk to someone about suicide. If they were not already thinking about it, you might give them the idea to try it. That's a myth. The stigma. It is often considered taboo to talk about suicide or to admit to having suicidal thoughts. But open discussion and awareness is needed to protect those at risk of suicide. Being aware of the facts about suicide make you a vital partner in suicide prevention in our community. What you can do, you can listen, ask the question, get help, and find resources. How can you listen? Be open and patient and listen for the meaning behind the words. When one hears about the meanings behind the words, you will hear someone say, for instance, I'm sick of this life. I can't take it no more. I just tired. Those meanings can be, they are considering of taking or committing suicide. Support their being open about suicide. Do not judge. Do not minimize their pain. Offer empathy rather than try to fix the problem. Ask the question. Ask clearly and directly. Are you thinking of suicide? Discuss risk of suicide, and you can disable any immediate plan they have. Offer support and compassion. Get help. Find resources. Do not try to do it alone. If you try to do it all alone, you will end up in some serious problem. Never keep it a secret. This is not the person who going to be a suicidal person keeping it as a secret, but you who knows. Don't keep it as a secret. Explore resources together. Go to Mental Health Foundation. Look to a professional clinician. Factors that may increase the risk of suicide. These factors are trauma, current and past physical, sexual, or emotional abuse and or trauma, triggering events, factors, stressors, or internal personal triggers, especially those leading to humiliation, shame, despair, or loss. Ideation, presence, duration, and severity of thinking about death or ending life. These could be current or from the past. Medical health, current and past medical health concerns or diagnosis, especially a new diagnosis or worsening symptom. Mental health, current and past mental health concerns or diagnosis, especially with recent discharge from mental health treatment or hospitalization. Warning signs. Although there are many warning signs, every situation is unique. The key is to understand how an individual feels about their life and how the current situation is. Warning signs again. Current talk of suicide or planning. Hopelessness. Cannot cope with intense emotional pain. Overwhelmed. change in behavior, sleep, eating patterns, anxious, restless, or depressed. Express your feelings. If you keep your feelings to yourself, you carry a burden that can become unbearable. But if you share your feelings, you may lessen their burden, intensity, and even gain a fresh perspective. Talk to someone today, perhaps a family member or a trusted friend. You might also express yourself by writing down your feelings. The Bible says, "A friend loves at all times, and a brother is born for adversity." You can read this in Proverbs chapter 17, verse 17, from the New King James Version. The meaning of this is we need the support of others when we have distressing thoughts. Get professional help. Suicidal thoughts may be a symptom of mental or emotional illness. Like physical sickness, this is nothing to be ashamed of. Mental and emotional illnesses can be treated. Remember, anyone can be at risk for suicide. Take every threat seriously. Listen, ask, get help. You take care of yourself. Based on a mental health survey I conducted, there are several thoughts in our community of suicidalness. Our school children are also having these thoughts and need to be counseled. We have experienced 7 deaths by suicide from 2022 to 2024 on St. Martin. The last word, end the silence, ignite hope, prevent suicide. My resources for this presentation is Lisa H. Gold, MD, and Richard L. Frison. The book, Suicide Risk Assessment and Management, copyright 2020. Karen Mason, Preventing Suicide, a handbook for pastors, chaplains, and pastoral counselors, copyright 2014. Care, community awareness, resources, education, and I thank you.
Thank you for taking the time to watch the previous enlightening presentation from Grace Hill Bible University, St. Martin Campus's Suicide Assessment and Prevention Masterclass, themed Igniting Hope in Our Community, Preventing Suicide. We are extremely grateful to the Honorable Minister of Public Health, Social Development and Labor, Mr. Richard Brook, and his cabinet for agreeing to collaborate with us. This masterclass was presented by the students of the Master's Counseling Degree Program of Grace Hill Bible University, St. Martin Campus, both as a public service and as part of their grade for the course, Introduction to Suicide Prevention, Assessment, and Treatment. I am Dr. Ernie Mae Francis Cotton, the chair and developer of Grace Hill Bible University's Counseling Degree Program for the St. Martin Campus, in collaboration with Victorious Living Foundation, of which I am the visionary. Victorious Living provides personal and professional development tools to transform families, relationships, youth, individuals, and organizations through coaching, training, counseling, retreats, workshops, and conferences. Let me briefly share about Grace Hill Bible University so you understand the mission and vision of the university. Grace Hill Bible University equips men and women for Christian living and Christian service worldwide. Its vision is to bring glory to God and hope to the world by preparing students for Christian service. GHBU is accredited by Global Accreditation Association for Biblical Institutions, which is authorized by the state of New Jersey. The degrees and programs offered either meet or exceed the New Jersey status. The university was founded by its president, Dr. Aldanza Ambrose. The dean of the St. Martin campus is Dr. Orlando Wilson. So who am I? And why do I qualify to be able to develop and teach a master's level counseling degree program? Well, I co-developed the grief counseling course for the Bachelor of Science in Social Work for the University of the West Indies. I graduated with honors from the University of Tampa in 1995 with a BA in psychology. I earned a master's in counseling with emphasis in marriage and family therapy from the Oral Roberts University in 2000. I was awarded an honorary Doctor of Divinity by Grace Hill Bible University in 2006. I'm a certified success coach with the International Coaching Federation, a certified lifestyle prescription health coach, and emotional freedom techniques practitioner. I also obtained specialized certification in trauma therapy and have been successfully providing therapy and coaching locally and internationally for the past 25 years. In short, I am a master therapist who helps my clients to transform their lives. Several years ago, I was asked by the Dean of Grace Hill Bible University to teach a biblical psychology class. And while preparing to teach that class, I did some soul searching and admitted to myself, too many people in our societies are emotionally, psychologically, relationally, and spiritually challenged. As a result, our families and communities are experiencing dysfunctional and unhealthy relationships. I determined that if I am truly to help our students make an impact on our island and the world, they must be equipped to meet people where they hurt most and have the necessary skill set and mindset to transform their lives. Consequently, I set out to design and develop Grace Hill Bible University St. Martin campus's counseling degree program. I'm delighted to share that we've had several pioneers who graduated from the program and are making a difference on St. Martin and in the world. Our classes are offered online through our virtual classroom. Therefore, anyone from around the world is able to access our courses. We provide the curious learner who has a passion to counsel the fundamentals of counseling to be able to address the growing needs and challenges in our societies. Courses include Christian counseling from an African indigenous perspective, utilizing energy psychology in counseling, effective counseling techniques for transforming the lives of children, young people, and families, which is being offered this semester. The fundamentals of marriage counseling, counseling ethics, suicide assessment, prevention and treatment, spouse abuse, a treatment program for couples, effective grief counseling, counseling practicum, counseling internship, and more. Last semester, our deep dive focus was suicide assessment, treatment, and prevention. Our island has experienced the tragic loss of precious souls over the past several months due to suicide, which has sent shock waves in our community. Our hearts go out to the families who have been directly affected by these deaths. It is therefore absolutely imperative that as a nation, we are aware of the signs that someone is contemplating suicide, and that we have the necessary tools to support and encourage them to find better solutions to their challenges. Therefore, this course serves such a need. Together, and I mean together, we can transform the health of our nation through education, and we can prevent suicide by igniting hope in the hopeless. Thank you for your attention, And together, let's take care of ourselves and each other and transform our nation.